Ladies, what if you could skip going to the doctor for cervical cancer screenings and get a test done at home? The American Cancer Society approved it this month, but with certain caveats. King 5's Christine Pei reports on the latest guidelines in this week's Health Link.
Cervical cancer screening typically involves getting a pap smear or HPV test at a doctor's office. But now an FDA-approved at-home self-test is gaining traction as a screening option. Dr. Sarah Temkin is a gynecologic oncologist with the American Cancer Society.
They endorse HPV self-collection as an acceptable method of cervical cancer screening.
HPV, short for human papillomavirus, is what primarily causes cervical cancer, so checking for it is a common first step in screening.
These changes are meant to reflect new research in the area and the FDA's really pretty recent endorsement of HPV self-collection in May of 2024.
The new guideline applies to women with no history of cervical cancer or certain pre-cancer conditions, also women who have weakened immune systems. The goal is to get more women screened, even if it means letting women do so at home.
I think it's actually been very well received by most clinicians because they do recognize that a lot of individuals have barriers.
Dr. Heidi Gray, a gynecologic oncologist at UW Medicine and Fred Hutch, says the focus is to improve access to screening. Cervical cancer is highly preventable, but ACS data shows nearly 13,000 cases are diagnosed each year in the U.S., and close to 5,000 women die from it annually. Experts say many of these deaths could be prevented with proper screening, which sometimes faces barriers.
The biggest kind of, patient barriers are, historically kind of underserved patients, otherwise low or no insurance, no access or limited access to providers, fear around, the actual pelvic exam, prior trauma or prior experience in the past with that.
While it's not yet clear if insurance companies will cover these at-home tests, Dr. Gray says cervical cancer screening in general is typically covered by insurance. She's hopeful the new self-collection tests will be adopted by insurance plans. Those who test negative with self-collection still need to be screened again in 3 years. If the test comes back positive, patients need to see a doctor for additional testing. The guidelines also clarify that screening can stop at age 65 only if patients have had regular negative screenings and no history of precancer or cancer. For HealthLink, I'm Christine Pei reporting.